Welcome to Building the Future, hosted by Kevin Horick. With millions of listeners a month, Building the Future has quickly become one of the fastest rising programs, with a focus on interviewing startups, entrepreneurs, investors, CEOs, and more. The radio and TV show airs in 15 markets across the globe, including Silicon Valley. For full showtimes, past episodes, or to sponsor the show, please visit buildingthefutureshow.com.
Welcome back to the show. Today we have Kal Vepuri. He's the founder and CEO at Hero. Kal, welcome to the show.
Thanks, Kevin. Really excited to be here, and thank you for having me.
Yeah, I'm excited to have you on the show. I think what you guys are doing at Hero is actually really innovative and cool, and a lot bigger of a problem than I think majority of people realize. But maybe before we get into all that, let's get to know you a little bit better and start off with where you grew up.
For sure. So I had immigrant parents from South India, and
Very cool.
was born in the States in the Midwest, and then kind of migrated around the country back to India, and then sort of landed in the East Coast. And so most of my life, I grew up between New Jersey. At least most of my youth, I grew up between New Jersey and Pennsylvania, and that's where we got started.
Very cool. So you went to university. What did you take and why?
I went to Duke University, and I studied electrical engineering, computer science, and economics.
Okay,
Uh,
interesting.
Probably a little ambitious or overly ambitious at the time, but I try to be a left brain, right brain thinker, but really enjoyed tinkering, and had started building, hardware in high school and writing software even in late elementary school. And so
Oh, wow.
I just wanted a way to actually learn how to do things from sort of the ground up versus the more organic kind of learning that I'd had up until then. And for me, it was exciting to be in a place like Duke, which is a pretty big research institution, and had some access to incredible resources both on campus and through its alumni network. So for me, I just wanted to soak it all in as much as I could while I was there.
Sure. So what got you passionate about kind of programming and building electronics at such an early age?
It's an interesting question. I guess it was just one of those things that I was drawn to. I'd always really loved games, and I
Okay.
think for a lot of people who are in the tech world, a lot of their sort of early experiences were similar in the sense that they first used technology when it was brought to them in some sort of game format, or gaming technology. And so for me, I would say that was what got me into it initially. I started writing games in the late 80s, in BASIC, and I thought it was just kind of the most engaging way to spend all of my free time. And then eventually, when the internet came to be in the mid 90s, I was in high school, and I started building websites, and thinking about how to host websites, and so started doing that for myself and my friends, and then started doing it for some small businesses, and then started doing it for some university departments, and got to know kind of academia a little bit, and found it really fascinating. Again, that it had such incredible access to resources. So that was sort of how I got drawn to research and academia from that actually entrepreneurial experience.
Very cool. So you get out of university, walk us through your career up until coming up with the idea for Hero, and then we'll get into what exactly it is.
For sure. So I mentioned my sort of little gaming adventures when I was very young, and then jumping into web hosting and email hosting in high school. I sold that kind of small business during the first sort of internet boom, and
Nice.
then took that capital, and after I was doing some consulting work for folks who were trying to figure out how to acquire wireless spectrum, which
Oh,
is
interesting.
which there was sort of a gold rush on back then. It's all the bandwidth that we use for our data and voice now. You had to acquire from the government originally. And so the FCC auctioned off all these licenses for different geographies. And I was initially writing software to help folks figure out how to do that efficiently and bid efficiently to acquire what they wanted. And then ultimately I took the earnings from my kind of small exit and started doing the same. And I was doing that through college, and then after school, did a fellowship for a year because, as I'd mentioned, I was just fascinated with academia and actually really wanted to be a professor in my heart of hearts after that experience. But ultimately, once I was doing that fellowship, I realized that it wasn't for me. And so I started working I was lucky enough to get an offer and started working at a firm called Bain and Company, which is a pretty interesting place, and a place where there's many brilliant people working on really interesting problems, particularly for folks who are really young in their career, to learn a lot about a lot of different industries and work with really talented, experienced management teams, and due diligence on investment opportunities for big venture firms or private equity firms or other groups. And so did that for a few years, and then worked in private equity to learn what it meant to actually be an investor. Excuse me. And how to put capital to work in really meaningful ways, and learn kind of all the different moving parts around that. And then while I was in private equity, the wireless spectrum that I had bought a handful of years prior started to garner a lot of interest, and I had been sort of doing that as a side project, and ultimately ended up selling all of those licenses, and basically over the course of a year and a half or two to two of the national carriers.
Oh,
And then
interesting.
yeah, so that was sort of right before the credit crisis.
Okay.
And so was pretty fortunate in terms of the timing there. Obviously, I had no idea that would happen, but what it led me to start doing after a year of sort of eat, pray, loving, and traveling and trying to trace roots and do a little bit of charity work, I started thinking about where I wanted to spend my time and really the rest of my life. And I guess the best I could do, given the broad range of interest, was I wanted to work with entrepreneurs and as a true partner, as an investor, and maybe at some point build a business of my own. But I realized it'd been a little while since I'd done that, and frankly, I had a lot to learn. So I started, like many angel investors, just kind of engaging with the technology community, and this is around 2011.
Okay.
When I really started to be kind of very serious about this, and then on the East Coast, I started engaging with former colleagues who I knew were starting businesses, or I'd heard were interested in exploring doing that. And what sort of started to happen was, on the East Coast, there was this whole flock of early B2C businesses, whether they were e-commerce or consumer services or consumer financial services. And then on the West Coast, there was all sorts of kind of really interesting companies being built, of course, but I tended to, find more businesses in the sort of enterprise and B2B space that I could partner with. So, so that was sort of how I was started spending my time, and started angel investing very actively, initially with pretty modest checks, to just learn and meet really smart angel investors and entrepreneurs, and figure out if I was any good at it, and whether or not I could really help folks. And I found there were some companies that I could help a lot, and others that it was a more serendipitous, and maybe some relationships would be helpful down the line. But ultimately, what I was seeing is it's really hard to build businesses, and incredibly underestimated by most. And
Sure.
so for me, that set the bar really high for me to ever start a business again. And so high, in fact, that I didn't for another five, 5.5 years. And so fast forward to sort of 2016, I've invested now in about 150 businesses.
Wow. Some big names too.
Big names, yeah. Seeded a lot of the early e-commerce players, Warby and Harry's and ClassPass, to name a few. Sweetgreen, which is in the food space. Docker, Oscar Health, Clover, on the healthcare and B2B side. So that was, going really well. I was having a lot of fun, trying to help folks and find interesting companies to partner with. But what started to happen was that I started to see other opportunities to build companies, and I felt like I was starting to learn, kind of as much as I could on the investing side. And so I wanted to start to flex some new muscles, and keep learning. And so initially started incubating and built a few e-commerce businesses. The sort of most well known of is a outerwear brand called The Arrivals, which makes technical outerwear with a lifetime warranty, and is sort of has a European kind of sensibility to it. And so that's done great, and is a great organically growing business.
Right.
And so it wasn't really a venture business, and it wasn't really intended to be. It was really just a way to sort of think about how to or internally process the ways in which people can build companies on the internet again, and doing that directly. And so that was a jump into building again. But what really spurred Hero is that in 2014, my mother had a heart attack.
Oh, sorry to hear that.
She is a physician who
Okay.
herself was pretty skilled at training other geriatrics or seniors on how to take care of their own health, and working with their caregivers to support that effort as well. And so when I say caregiver, it's usually a family member or another loved one who's helping them, particularly if they're seniors versus a younger chronic disease patient. So that was a eye-opening event for me, and changed the direction of my life, pointing it to what Hero ultimately became. And it did so in a few ways. One, I learned that it was incredibly hard to take medication correctly when you're someone who has to take 5, 10, 15 or more meds every day for the rest of your life.
Sure.
It's a full-time job, not just for you or your loved one, but also something that requires coordination with a lot of third parties.
Right.
And in addition, it creates an immense amount of stress, oftentimes depression, and general kind of loneliness, because your family relationships start to circle around the things that are troubling you from a health perspective. And did you take your meds correctly? Oh wait, I saw that you didn't take this. Or or God forbid, you have a drug interaction that could have been avoided, or you have to go to the hospital because you missed something, or a prescription expired because you weren't taking it consistently. These are all the things that sort of aggregated up into this really hairy, complicated, and painful process. And so that's where I sort of took a pause and wanted to really understand, is there a way to solve this for not just my mom, but potentially, everyone who is really suffering from this.
Sure. Yeah, I think a lot of people don't realize how big of an issue it is until they or somebody they love or know goes through it.
Yeah, it's definitely one of those things where if you're not in the unfortunate position to have to be managing meds for a family member, or just the overall health of someone in your life, it's it's probably not something that you would have much experience with or really understand in terms of the not just the magnitude of people that are affected by it, but also because or also the complexity of the problem itself, for each family. Um, it's just it is not something that people enjoy talking about, right? As you might imagine, right? If
Sure.
you're unhealthy, the last thing you want to do typically is harbor on that in your public life or in your social life. So it's not something that people love talking about. It's just something that they sort of internally manage, and that's where a lot of the stress and emotional damage can come from.
Sure. So, how did you figure out what Hero has become, and how did you actually make the decision to decide to actually start building this? Walk us through the early days of Hero.
For sure. Yeah. So it was um, it was hard. It was really, really hard. We didn't have a lot of we as in society doesn't have a great deal of information around how people actually behave, um, when they're at home as it regards to their medication. And
Interesting.
the reason for that is we see our physician. Our physician says, well, you have this chronic disease. I'm going to write you a script, or usually multiple scripts for that. And then I'll check in with you at some time down the future, and then we'll modify as needed. Um, and then everything that happens in between, typically is not very traceable.
Okay.
The one thing you'll know is if somebody takes that script and actually goes and fills it, and insurance is paying for it. But even that in today's environment is harder to track, because there's a growing number of people who pay for things with cash because it's
Right.
less expensive, or equally as expensive as their copay through their health plan. There's a growing population of folks who try to use holistic medication or supplements to manage medication, or modify their diet and sort of self titrate, meaning self manage their meds, which is obviously incredibly dangerous, but happens all the time. Um,
Sure.
and so, what we had to do is really ask individuals who suffered from multiple chronic conditions, where they would have to take medication themselves, really ask them how they do it themselves. And so we had many hundreds of conversations with patients, and then many hundreds of conversations with caregivers, and then many hundreds of conversations with people in the other sort of stakeholder groups around patient care. So that's um, physicians, nurses, pharmacists, health plan administrators, care managers, home care aides. And so we sort of had to quilt together this deeper set of knowledge and understanding around what are the friction points that make medication management so hard, and how do we address them using technology. And initially, the intention was not to build any piece of hardware per se. It was rather to really just understand how to unwrap this complex challenge and then apply technology, whether it was software or anything else, or people or services to address it. And basically, as we went through that process, we found that the only way to do it was with a new piece of hardware that didn't exist.
Okay.
And so we had to go about inventing it. And so that was a whole another chapter to the story. But ultimately, what the hardware did for us was it created accountability in a fun, magical way for individuals in their home to take their medication. It gave us transparency that every single dose on a per med basis in real time was being taken correctly. And then we shared that confidence with the caregiver, and increasingly over time with other stakeholders in that patient's care.
No, that makes sense. So when you finally decide to build hardware and software, like walk us through prototyping. Did you self-fund this? Did you raise some money? Did you use your own investment firm to invest? Walk us through that.
Sure. So when we were doing what I call sort of customer development, really the most important phase of any company, um, we didn't need capital. We just needed time. And so
Okay.
so that was largely myself and a few other folks who were interested in working on this, sort of talking to folks. And once we started to put pen to paper around realizing that, okay, we probably need to build some new technology, it probably needs to be hardware. That's when I started thinking about budgets and teams and all of the things that you would as a founder of a startup. I wasn't so sure if the company would be a startup versus kind of a project, to be honest, because
Okay.
this was such a new idea, and kind of a white space that I wanted to make sure that we didn't really treat it as a venture business to start, until we knew more and we de-risked it a bit. So I was in the fortunate position, obviously, to be able to kind of fund the costs of that early development and validation phase from when
Right.
we went from customer development to validation and inventing the hardware and the technology to do what we do. So through that, it was funded by me. And once we started to realize and sort of figured out that this is a huge problem, not just in terms of the data itself, but in actuality from a market size and need perspective, we were onto something in the sense that we were building a friction-free way to manage medication with transparency from all corners. So, if we could save over 125,000 lives a year and hundreds of billions of dollars in costs to the healthcare system, which benefits all of us, because it's a phantom tax that we all bear, because
Sure.
we're already spending the money to diagnose people and for physicians to write them scripts, and if they're having hospital readmissions and having to use the healthcare system regardless, then that's a huge amount of wastage. Not to mention
Sure.
pharmaceutical waste itself in terms of drugs that are dispensed that aren't taken. So we sort of started to learn all that in a practical sense, and people really started to resonate with it. And um, so then we figured out the business model. We realized that we had to have a membership plan in order to support all the needs that people had, given the fact that this was something where people had questions all the time around medication. We had to do continual hardware and software and firmware updates and add new features every month. And it was a very hands-on approach, and of course, offer 24/7 member experience and all the things that we've all come to really appreciate and expect from services,
Sure.
particularly ones that are really related to our health. And so that's when we decided to bring on some third-party partners. I continually reinvested capital into the business, and am one of the major shareholders in the company. We brought on some additional capital partners that are larger larger capital partners as well. We brought in a number of folks who are from the healthcare industry and have incredible reputations when it comes to how to partner new technology with health plans and the other risk bearers in our health system. And the reason for that is risk bearers stand to benefit greatly from Hero, in the sense that we by utilizing Hero in their really high risk populations, so these polychronic polypharmacy patients, they're able to reduce the long-term medical costs of those lives. The individuals themselves are healthier and have better mental health and have much higher satisfaction with those health plans. And so we really focused on people who could help us with that. And so that's something that we continue to explore and develop as well. And then we basically just started to grow really fast. So the past few years has been really exciting for us. We've brought on some incredible hires from places like Google and Peloton and others, and it's just been a lot of fun. Obviously, hard work every day, but as you know, we're in that exciting phase of our development.
Sure. So, how many prototypes did it take to get it to the current version, and how did you come up with the current look and feel? I know it's kind of hard to describe that when it's audio only, but how do you usually describe the product to people, and how has it kind of evolved and to what it is today?
Yeah, it's funny. There's a lot of folks out there who like to use different descriptions for what Hero is. The
Okay.
closest sort of thing I've heard is a Keurig for
Yeah, sure.
medication. And the reason I like that is because I think it gives people kind of a discrete way to think about Hero. You have footprint, scale, kind of the fact that it dispenses things. The thing about it that is tougher is that we have to provide an open system. So we don't make the medication. In many cases, we don't send the medication to the member. They use their own whatever, mail order pharmacy or third party retail pharmacy. We can, in many cases, people do choose to use the Hero partnered network of pharmacies for mail order, but we just have to we have to give people a way to work and live within the construct of how they want to manage their meds no matter what. And so the system has to be open, it has to be accurate, it has to be flexible. And so Keurig for medication, I think, is a good way to think about it physically, in the sense that it's a countertop appliance. It's push button and easy to use. But it does leave out the complexity around the fact that it needs to be Wi-Fi connected, because that's how we know if you are able to manage your meds correctly. It's how we're able to ensure that there's no issues with respect to other potential risks, whether that's trying to warn you of drug interactions or things like that. It's also a very complex type of user. When you think about people who are later in life, there's things that you need to design around that you don't really think about all the time as a younger person, in particular a younger, healthier person. And so making sure that the way that you run through setup, and the way you visually interact with it, audibly interact with it, making sure that all of that is very broadly accessible to folks who are maybe less mobile than most, or are able to apply less finger pressure, or whose vision is blurry. Those are all things that we needed to solve for. And obviously on top of that, there was this continuous focus, and continues to be our primary focus, is safety, and making sure that we are providing an experience that creates safe usage, and the safest usage we can reasonably provide. many of the executive team members, and actually just team members in general at Hero, we have family members who are early users and continue to be users at Hero. And so not only do we say that our members are our family, but it's actually the case.
Interesting. Well, and then something as simple as just pills are all different shapes and sizes, right? You have to handle that too.
Yeah. So to try to develop a system that that accurately isolates pills of any size, shape, weight, or orientation in any ambient environment um, at any sort of altitude that a human would live in is challenging, and is an imperfect science initially, and you try to sort of chip away at all the edge cases to eventually get to something. And then not only do you have to get to something that works, but you also have to be able to turn it into a product that's manufacturable and scalable and testable, and then meets all the usability requirements that I was sort of referring to. It took the better part of 4 years for us to do that, almost 5.
Wow.
And then we had to test it, make sure it was safe, and then go from there. So it was, and there's also a regulatory component of what we do. So all of that created a lot of complexity. And I think if it weren't for the fact that we were so personally aligned on the mission of what we were trying to accomplish and had such deep personal experience with the problem, there were many times along the way where we were sort of like, wow, I don't know if we're going to be able to get through this, but thankfully, one foot in front of the other, we pushed through.
No, that's really great. So I'm curious though, like it has to just be pills, like it can't be liquid medicine, or is that just like a whole other can of worms?
I wish it could be everything, right? There's definitely folks who take liquids and powders and refrigerated medication or injectables like insulin.
Sure.
And that much of our population does have to deal with that. The vast majority of medications are available in pill format.
Okay.
And so when you think about sort of like what's the meat and potatoes of medication management, it's things that come in pill format.
Gotcha.
The great thing of that you bring up a really important point though, which is if you take anything else that needs to be stored outside of Hero, we had to make sure that it integrated with all the notifications and the alerts and the reminders, and our web app and our mobile app, and our member experience team was aware of them, and that the user was confirming whether or not they took things correctly. And so that is very deeply integrated into the system, such that we get data not just around what Hero is dispensing, but also we ask the user and caregivers to confirm that anything that's outside of Hero is taken or not taken. So yes, it is definitely a very different can of worms, but it's also it's a minority of the actual medication that's consumed, a significant minority of the actual medication that's consumed in this country.
No, that makes sense. So I'm curious, you touched on it kind of throughout our conversation so far, but how does the software tie into, you mentioned notifications, but how else do people actually use and interact with the app and the web?
So there's a few ways to interact with the software that we develop and the apps that we develop. One is for sort of setup, and that is, what medications are in the regimen, managing the regimen, ensuring that all the limitations around maximum dosage and passcodes are as you want. And if you ever need to change them, you can change them using that sort of part of the toolkit. The second would be notifications and reminders, as I'd mentioned. So that's if you're late, or if you've missed a dose, if you need to pre-dispense doses because you're going to be out of your home for a while, if you are going on vacation and you need to dispense a number of doses, all of that is sort of another set of needs. And then the third would be data and other sort of tracking. So we have we have drug information access directly in the app. We have the ability to get drug interactions if you would like to understand that, to make sure that there's no complexity there. Look at historical adherence for yourself, or if you're a caregiver for your loved one. So you can see how their adherence has changed over time, and also understand what that means in the context of, you know, how you perceive them from a health perspective, and how they perceive themselves. And you'll see that sort of last set will continue to develop, you know, very, very significantly over the next year, as we develop more product features along those lines.
Sure. No, that makes a lot of sense. And the interesting thing too is just being able to have a digital record to know if like a friend or family member is actually taking their medication, right?
Absolutely. So it's not just a digital record, but a record that can be shared not just with family members, but with your healthcare provider as well.
Right.
So having complete transparency across sort of we call the entire care team, right? Friends, family, loved ones,
Sure.
and your healthcare providers has never really existed before, because again, there hasn't been a real last line of communication that has objective information about everything somebody's actually taking, whether it's medication that was prescribed and reimbursed through a health plan, medication that was cash paid for, over-the-counter medication, or vitamins, minerals, and supplements. And so, since we have that sort of holistic view, it's something that, you know, we're just in the early days of scratching the surface on, in terms of the value that can provide, especially when you start to integrate it with other sorts of data sets. And, you know, in this increasingly connected biometric world, you know, we're very excited about that.
Sure. So you mentioned pushing features and updates, you know, monthly or however often. How do you decide which new features that are in your roadmap that you want to push out compared to some of the requests that you get from users? How do you manage those two and decide what a user request actually goes into the actual hardware and software of Hero?
It's imperfect in the sense that there's a little bit of us thinking a few steps ahead, and you know, taking the Steve Jobs approach of basically you know, jumping ahead of the current technology limitations and thinking about the future of what the product really should be in 2, 3, 5, 10 years. And so we always have that in the back of our mind. But we're fortunate to have a really close relationship with our members. You know, they use Hero many times a day. Their caregivers are oftentimes engaged with their health as well. Our member experience team is on 24/7 and in contact with folks who need answers to anything. And so we get feedback through many different channels, many times a day, oftentimes even from the same member or their caregiver kind of unit. And so what that's done is given us a wealth of really interesting, not just information, but almost a roadmap on its own, in terms of, you know, what people really need, but also what people want. And we take that and we prioritize it as best we can. And we work really hard as quickly as possible to build all of those incremental features or improvements as quickly as we can.
Sure. So obviously, like, you don't have to give away anything that you're working on that you don't want to talk about, but where do you take Hero from here? Do you want to just stick with the one device? Do you see maybe building a second, third, fourth device around the space, or how do you see the potential future of Hero and or the healthcare, kind of smart healthcare space?
Um, there's a lot that I could say there, but I guess the short answer is we will do whatever needs to be done to keep people safe and taking their medication correctly
Okay.
in their home. And so if that means that we need to build more hardware, then we'll do it, right? And we'll do it thoughtfully, and we'll try to do it in a way that makes it completely accessible and scalable and rock solid and safe. But um, that's ultimately our sort of true north, is do right by these people who historically have been really marginalized and not well considered by even the entrepreneurial community in the healthcare space. People just kind of make assumptions about what it's like to be a polychronic polypharmacy patient, and we try to build different ways. We try to historically, in my opinion, take top-down approaches to solve problems in the healthcare space, and
Yeah.
and kind of push things to individuals. Hero is user-centric, so everything we do is based on the behavior that we can track and measure and what they tell us, right? And so that's what we'll continue to do. And so far it's not only served us well, but really made us a loved part of the family for these these individuals and their loved ones. And in terms of digital health more broadly, we were actively partnering with, as I'd mentioned, many different parts of the healthcare ecosystem. We'll have more to say about that this year and next year. And I couldn't be more excited about what's happening, not just in sort of our sphere, but across the entire spectrum of healthcare payments and reimbursement and pharmacy itself, and then different parts of care management and care coordination. It's an incredibly exciting time to be building something in the healthcare space, and I think we're just at the very beginning.
Sure. Do you think that it's gotten easier, stayed the same? Or what are your thoughts on kind of the red tape that's still kind of in the industry that I think in a lot of cases just discourage people from maybe getting into the healthcare space because they're just like, it's just too complicated. I don't even want to bother.
Yeah, I think that's a sort of two-sided coin. On one side, that red tape exists for a reason, right? It's to protect people
Sure.
and make sure that they're safe and and not being exploited and all the things that we as a citizenship want to make sure that is held true. On the other side, I think it gets to be a grayer area, and I think thankfully we do have while we have a bipartisan government, I think there are many really reasonable and smart folks who are moving things in the right direction, and that that's been great to see as an entrepreneur and an American, that we are starting to make really important and significant strides in making it easier to develop new technology, test it, launch it, validate it, and then integrate with the existing stakeholders and figure out an economic model that works. And so it's definitely better than it was 5 years ago. I think it'll be markedly better 5 years from now, and in between it'll just keep chugging along in the right direction, hopefully. So I'm pretty optimistic. I think I have pretty good reason to be in terms of what's been happening more recently, and I think that's going to create a tremendous amount of entrepreneurial activity that continues to build momentum.
No, I agree with you. I think that's kind of what I figured. So I'm curious though, obviously you've helped a ton of companies, you've built something in the hardware space, the software space, you've been in the tech space for a really long time now. Is there some advice or something you want to maybe like demystify a little bit that you kind of wish you knew, or you tell people that you see all the time that you say like you shouldn't do that, or maybe something that they should do more of? Like, what's some general advice you'd give to people based on your experience being an entrepreneur, investing in them, and being in the space for so long?
Yeah, I mean, I guess what I say to a lot of people is be careful taking advice,
That's good
which I guess
advice.
sounds paradoxical. Um, you know, every person's path is different. What they really care about is different. What excites them and the types of problems they want to solve. It's all really unique. In some ways, sort of an artistic, endeavor to figure that out. And so what I encourage is really people to, not be afraid of making mistakes and trying lots of things, as young as possible, and to try to learn from that, and, figure out what they like and what they don't like, and what they're really drawn to from a personal passion perspective. And if they can marry that with, how they spend their time, then that's a magical thing. And, that doesn't necessarily even have to be entrepreneurial. But if it is, that's great. And when they start down that path, make sure that they continue that process of experimentation, and not being afraid to make, some mistakes along the way. But doing that by having conversations with lots of people and lots of mentors, and taking that information and then processing it for themselves. Because ultimately, if you're an entrepreneur, certainly, you should know more about the problem you're trying to solve than anybody else who's sort of thinking about it with you, from a sort of a seat across the table.
No, I think that's really good advice. And the one thing I think that we should add to that you mentioned earlier is somebody like you even went through times where you pondered giving up, but you fought through it and you didn't give up and you kept going, right? And I think every entrepreneur goes through that many times in their career, many times while they're working on one product or project. And I think, you kind of need to know when to just kind of sit back and say, no, you know what, this is just a challenging time. I'm not going to give up. Or, maybe it is time to pivot at some point, right?
Yeah, it's that part is hard, no matter how you cut it. Ultimately, there's a little bit of blind faith that goes into every point where you want to stop, and that sort of, that leap is what, oftentimes defines the greatest entrepreneurs of our time in history. And sometimes it works out. It doesn't always. That's just part of building things. And the beauty of it is if it doesn't work out, you learn from it, and you can try again.
Sure. Well, sadly, we're coming to the end of the show. So how about we close with mentioning where people can get more information about yourself, Hero, and any other links you want to mention?
For sure. So Hero is accessible at www.herohealth.com. There's lots of great information about Hero and how it can support anyone who struggles with medication management and their caregivers. If you want to reach out to me or hear about or see what I'm thinking about, you can go to Twitter and follow me at Vepuri, and that's KALVEPURI.
Perfect. Well, I really appreciate you taking the time out of your day to be on the show, and I look forward to keeping in touch with you, and have a good rest of your day, man.
Thanks, Kevin. Really appreciate it. Great to speak with you, and thanks for having me.
Thanks. Okay. Bye.
Thanks for listening. Please visit our website at buildingthefutureshow.com to join the free community, sign up for our newsletter, or to sponsor the show. The music is done by Electric Mantra. You can check him out at electricmantra.com, and keep building the future.